Hey, what's up, Power Up Endo Nation? Let's get into the most effective and efficient way to collect data and formulate an endo diagnosis. I'm going to walk you through exactly how I perform an endo exam at every patient's interaction with a live demo. Realize that this is meant to be a concise patient encounter, and like I always do, in an effort to not waste your time, especially your chair time, I'm going to show you the system that requires the least amount of testing and gets you the information you need as fast as possible so you can formulate your endo diagnosis and hopefully deploy those sweet endo skills you've learned. Ideally, your assistant is going to acquire a bite wing and a PA in the area that your patient is telling them is the problem. Also, have your assistant get the long version of the chief complaint. This is key, so when your assistant comes to tell you they're ready for you, they can summarize the patient's chief complaint, which is going to allow you to be as time efficient as possible with your data collection. Also, train your dental assistant to bring any relevant medical issues to your attention at this point. I would encourage you to give the radiographs a good look before you even walk into the operatory. That way, more often than not, you have a really good idea as to what's going on with your patient before you even greet them. Is the tooth previously treated? Are there any large carious lesions? Is there an apical lesion? Any sign of resorption into or near the pulp? Did you recently place any restorations in the patient's mouth? This should only take you 5 or 10 seconds. All right, let's talk about an important point. Whether you're dealing with a new patient to your office with an emergency issue or an existing and established patient to your practice, if you're going to have any chance at getting through data collection, diagnosis, and some endo treatment, you need to be really time efficient, all the way from greeting to anesthesia delivery. You can have some small talk with your patient while you're waiting for the anesthesia to kick in. But if you delay too much initially, you're going to get really stressed out and be far more likely to throw your hands up simply because you didn't feel you had the time to provide treatment for them. That's not a good enough reason, my friends. Remember, I'm here to show you the way. For instance, if you had to squeeze this patient into your lunch hour and you don't pick up a handpiece until 40 minutes in, you're going to be really stressed out about not running late into your first patient after lunch. So do yourself a favor. Have your front desk communicate to the patient to arrive wicked early, like 30 minutes early, especially if you're dealing with a new patient, and just have it be communicated to them that there'll be a little bit of a wait since you're squeezing them into your lunch hour. That way, they can do paperwork, hopefully your assistant can seat them, acquire images, take their history, etc., without you waiting around. All right, so let's get into the operatory and cover the doctor-patient encounter in a live demo format. So you walk in and have your small talk with the patient. Don't overdo it, people. I'm so guilty of this. And just summarize for them the story your assistant briefed you on, as well as any relevant medical issues they've already told your assistant. Simultaneously, look at them while they're filling you in and see if you notice any extraoral swelling or maybe even some trismus. That way, you're already collecting data for your extraoral examination. If you don't think you'll be able to memorize all the data you're about to collect, then have your assistant take notes for you. But train them to write down only what's necessary and have them do it in a chart format, just like it was presented in World 2. Almost all data inputs are either positive with a plus sign or negative with a negative sign. If they have a hyper response, have your assistant document it as a double plus sign if you want. Say something like, "So I understand you're having a lot of pain or cold and it's been waking you up at night, is that correct?" Let them fill in the gaps, but you're trying to get right to the point here. Ask them to point out to exactly where they're feeling the pain. This is the best starting point and will save you a ton of time. Then go ahead and recline the patient and start by performing your intraoral exam in the area of interest. Now, 9 out of 10 times after hearing their story and reviewing their radiographs, you should know exactly which is the problem tooth. So look for intraoral swellings indicating acute apical abscess, Sinus tracts indicating chronic apical abscess, caries, cracks, or any other major issues with that tooth. Next, check for mobility and then take your mirror handle and perform your percussion test. Most of these tests will be done on 3 teeth, the suspected problem tooth as well as 1 tooth mesial and distal. Percuss the mesial tooth, then the distal tooth, and then finally the problem tooth. I wouldn't recommend you start with the problem tooth for most of your tests because you want to have a baseline reading before you load the suspected problem tooth. Next, palpate the apical areas of the 3 teeth. Radiographic lesions or hyperresponses to either percussion or palpation are going to be the main things to look for when determining whether you're dealing with apical periodontitis. Then have them bite on a cotton roll. Again, start with the mesial, then distal, then the suspected problem tooth. Now perform perioprobing on all 3 of these teeth and look for any deep probings. Pain on chewing, especially on release, usually indicates a cracked tooth, and isolated probings may indicate a root fracture. Finally, let them know you're going to be now testing for nerve vitality. You're going to want to explicitly state this since you will be coding for this. So bust out your EndoIce to perform a cold test. Now this is very important. Tell your patient to raise their hand as soon as they feel the cold and leave it raised until it goes away. Once they don't feel it anymore, then they're to lower their hand. Spray the cotton pellet that is being held by your cotton pliers and test the mesial tooth, then the distal tooth, and finally the suspected problem tooth. Remember, you're just trying to relate the problem tooth to the baseline responses from adjacent teeth. Cold testing the suspected problem tooth last is super important for time efficiency because if you're dealing with lingering cold pain, they could be raising their hand for minutes, and that's going to slow down the exam process. Negative cold testing obviously indicates a non-vital pulp, and positive cold testing indicates a vital pulp. Any hyperresponses or lingering cold pain are tipping you off to symptomatic irreversible pulpitis. This is the bare minimum amount of data you're going to need to obtain your endo diagnosis in 99% of cases, and this should only take you a few minutes of time. All right, Super GPs, there you have it. This is how I want you to perform your endo exams every time. I want you to be systematic so you don't miss anything. And once you go through it live on your patients a few times and put your flair on it, it'll become second nature and will be time efficient. I'll see you in the next lesson.